ahora mismo, entonces, perfecto.
Buenas tardes a todos y estamos muy contentos de tener este webinar hoy con el nuevo site de Two Ocean Health in Dominican Republic, manejado por la doctora Marija Mirik y el gran contacto de María Zunilda Núñez, quien ha tenido una gran trayectoria con nosotros en Ppcr. Bueno, yo soy Alma Sánchez, soy directora asociada de educación en el programa y a la vez profesor Felipe Fregni, quien es el director del programa y el fundador de este programa desde 2008, vendrá a la presentación. Ahorita él está en un NIH panel de reviewer, pero entra en aproximadamente 30 minutos, pero él también estará acá apoyándonos en este nuevo site. So, Wanda, por favor, inicia y muchas gracias nuevamente.
Claro, excelente. Bueno, lo iba ya a proceder con esta presentación en inglés. So, welcome to the Principles and Practices of Clinical Research, Ppcr's informative webinar, a leading global program that will be held in a new location thanks to the collaborative efforts of Harvard.
Como a mí lo hace así, para que no se maree.
Perdón? Oh, okay.
I just muted for you.
Yeah. It's okay. So it's part of a collaborative alliance between Harvard's T.H. Chan School of Public Health and Two Oceans and Health, which is a Dominican health research center dedicated to building knowledge that empowers communities in the Dominican Republic. So my name is Wanda Quesada, and I would be your moderator for today. I'm Two Oceans and Health Communication Manager. So first of all, we would like to thank everyone who is joining us today and hoping that this information presented here will be useful to all of you. On this webinar, we will be addressing details of the Ppcr course, as Dr. Alma said, and we will respond to any questions or comments that any of you may have. So without further ado, please welcome Dr. Marija Mirik. She is Executive Director at Two Oceans and Health and also Site Director of the Principles and Clinical Research, Principles and Practices of Research course in Two Oceans and Health. So she will give us a formal welcome, and please keep in mind that you can ask any questions in the chat, and or you can wait until the Q&A session at the end that we will have. So Dr. Mirik.
Thank you, Wanda, and thank you everyone for being here today. In the name of Two Oceans in Health, specifically Dr. Eddie Perez, our president, and the rest of our technical team, I first of all want to thank Dr. Maria Zunilda Núñez for being the vehicle for making this collaboration, this new collaboration possible. And of course, to the Harvard School of Public Health team, specifically Alma, for all her enthusiasm and all her support during the initial steps in this collaboration. This is a huge endeavor for our team. Those of you who know us, who know our team, and are familiar with our work here in the Dominican Republic, know that our passion is building knowledge that empowers our communities, constructing new alliances, constructing epistemic networks, and above all, creating a new network of scientists here in the Dominican Republic that can really use international standards of scientific rigor applied to our local context, to our local needs, and to the specificity of our health system in the Dominican Republic. So this opportunity of having this alliance with such a prestigious institutions such as Harvard School of Public Health, collaborating with Dr. Fregni's team, and being able to invite new clinical researchers, new young scientists into this project is actually something that is really a joyful experience for all of us. And while this is our first collaborative effort and our first cohort of students, we are sure this is not going to be the last, and we definitely want to expand on what this opportunity brings to us. So I will not take too much of your time. I know everybody's interested in the specificities of this course, in the contents, in the logistics, and how to apply, how to enroll. So I will just thank you once again for your interest, and truly hope to have you on board with our first cohort. And now Wanda will move forward with our agenda and try to give you more specific information. We will be here for any additional info you might need on our side. And once again, very, very happy to be a new host for this amazing course from Harvard. Please go ahead.
Yes, so thank you, Dr. Mirik. for this information and this warm welcome. So do we have Dr. Felipe Alma? Just to confirm. Okay, well, I will just proceed to present our next speaker for today, Dr. Zunilda Núñez. So we would just like to remind you that any question that you might have, you can just post it right ahead at the chat, or you can wait until the end of at the end of the webinar, where we will have the Q&A sessions. So please welcome Dr. Zunilda Núñez. She is Ppcr's National Coordinator, and she will tell us a little about how the introduction of this course in the country. So yes, you need to unmute yourself. Si le puede quitar el mute al micrófono.
Okay.
Bien, la
How
escuchamos.
do you hear me? Do you hear me well?
Sí, la escuchamos.
Okay. Good afternoon, everyone. And really, it's a great advance for the clinical research at Dominican Republic that Marija Mirik has said to work with us to have better research, health research at Dominican Republic. And I'm Maria Zunilda Núñez. I am myself internal medicine specialist, and I teach internal medicine for a long time. And around 10 years ago, the two biggest hospitals at Santiago, Dominican Republic, give me the responsibility to improve the research in the hospitals. And I find a bit, as everybody knows, a bit missing part in this goal at Dominican Republic. What I found is that we have wonderful MDs with excellent skill as a specialist, but we don't have the formal training to do health research as a MD. And I think we can help a lot to have better data for all the system, make better decisions. We are not we are part of the system, and I think we lack this information because our hospital, our centers, private and public, doesn't have the structure to give to the doctors how they make the information useful to have a better decision. So with this responsibility, in 2012, I decided to update myself about my clinical research because I'm a clinician, so that's what I can do. And I decided, and I find this amazing course that I never imagined it will be so life-changing for myself and for all the doctors that already did the course. These principles and practice of clinical research start at 2014 in Dominican Republic, and we have now 117 most MDs with already did the course. And I found that the people who start with this course as understand clinical research, love to be researchers. And at Dominican Republic, Marija, this is a great point. It's not only that the course is amazing. The teachers are wonderful because they are already researchers at Harvard University. They do research there. Is what motivate, how they motivate the MDs, inclusive specialists, to start doing research. And we think that more people who start with this is like the starting point of a new career that Dominican Republic need a lot. So everybody who wants to be a research in the health system, this is an amazing starting point because you have real learning. Phone learning is intensive. It's a course because there is around 60 psych centers in the world and around 400 students each year. So they can't follow one by one to say that it's a master in clinical research. But I can say that the only thing we lack to be a master is complete the investigation that you learn how to do it. And I really encourage Marija that you can start already at the same time. And I can be part of the system because this is a Dominican Republic effort. It's not from one institution. There is a lot of institutions that wants and need clinical researcher. And I really encourage, and I will do the thing I'm doing now to have at the same time, starting the course, prepare the master in clinical research at Dominican Republic for those who can't afford, because there is a master in T.H. Chan, Harvard University with this course. And there is a master in Alemania, in Dresden. There is a master in Peru. But for those who can't afford to do the master in these places, we need, and I can tell you by myself, there is a lot of students who already did Ppcr who like to finish the master so they can go on with the research career. So, and I'm here to, what I find is the people learn, the people love, and the people who love research keep going with the system. And what I did is not only do the course, I'm working with the lab for clinical research at these two hospitals. And this lab, Marija, lab is in the hospital. We have a lot of specialists who like to work with the system and start with research focus. So we can do amazing things with this starting point. And I'm here to answer any question in Spanish or in English, because when I did the course was, well, I have around 50-year-old. When I have to go to Boston because I need to have more deeply understanding because of the moment of my life and the position that I have in these two hospitals. And it's amazing what you learn, but the most amazing thing is the connection that we have. And now in this moment, and I hope something happening in this December 2021, we have a meeting with all the psych centers around the world, and we will start connecting each other to figure out how to do multi-center connections to work further. So to more people who have what principle and practice of clinical research do with us. We learn the same language. We understand the same way what we are talking about when we talk about clinical research. And there is the possibility not only work with clinical research, that is the fundamental, but you can go further to translational research if you want. In fact, with these points, clinical research, translational research, and social research, we connect all the system to figure out how to solve the biggest problem that we have as Dominican Republic, but amazing problem that we have as a human beings, because we have the lab with the people who come with us, and what, as you can see, and with the pandemic, we need a system that we can have real, reliable data, and we can see what's going on. It's not only how much we are, what's going on with what we'll do it, and we can help a lot with the this crazy system that a lot of people that doesn't understand about what they're talking about, telling to others to do things that is not correct. And we need to have this system. And I think this is an excellent starting point that MDs collaborate, but because we have wonderful researchers in social research. We have epidemiologists, amazing, but the MDs doesn't have the tools to help. And this is what I think, principle and practice, we help with all the system. In Dominican Republic, we are growing up in different areas of the social life, of the life. We are growing up a lot now. We can do as the same as a scientist too, because I know we are good. The only thing we need is how to do it correctly. And
that's right.
Everybody have to put the weight. The public system, the private system, the academic, and the people who like to work with industry can do it, but do it right. That's the thing that I think this amazing experience will help a lot. And we need a lot. Everybody have to collaborate to start saying the right thing. That's the principle and practice of clinical research. And you have to see that the people you are working on in the course is not the people in the psych center. Your college will be people from Alemania, from Egypt, from Abu Dhabi, from Brazil, from Chile, and we become part of the world as a researcher. And I think, and I know that we are ready to do it. So I'm here to any question that you can ask me about anything you know about this amazing experience in the Republic.
Thank you so much, Dr. Núñez, for highlighting this great achievement that this program will bring and enhancing research capacities in our countries. So I now invite Dr. Alma Sanchez, Associate Director of Education at Harvard T.H. Chan School of Public Health. So I turn it over to you, Alma. Perfect.
So hi, everyone. I'm sorry that I started first in English and then I passed to Spanish, but yeah, so the program is in English and I believe that it's true. We should do it like that, but also feel free to reach out to me in Spanish. It will be my pleasure to help you out. So as Wanda said, I'm an Associate Director of Education in the program, and I've been here, and I'm really happy that I've been colleague with Zunilda in 2012. We took the program together, actually. And then little by little, I also became a teaching assistant because we gave the option to the students to become a teaching assistant after you graduated. We train people on this, and actually we're working right now. It's a TA workshop since January 7. We're starting working with the new members of teaching assistant for this year. So Ppcr started in 2008 with the idea of Professor Fregni on how to deliver high quality clinical research outside Boston for people who cannot travel or cannot come and live here permanently, or because of the cost, because he was trained here. He's a medical doctor from Brazil. And when he came to Harvard in 2003, then he got at a glance, right, all the educational tools that Harvard offer. And then he said, how can I bring this to the world and make a program that is accessible and reachable to everyone? So then he created this program that is a 9-month program. We start every year in March and we end by the last week of November. All the lectures are live compared to many other online programs. Even though that we call it online, our program is really hybrid, meaning that we got many live activities that you will see your teachers, your teaching assistant, your colleagues live, and you will interact with them throughout the week and throughout the program. And then we have lectures that are broadcast live every Tuesday from Boston, from Harvard University, to all the sites worldwide. And right now we count with more than 50 sites. And that's, as Zunilda was mentioning, that's the beauty of this program, because you're gonna create and gonna be part of a huge network of research and collaborators, everyone trying to enhance clinical research and promote high quality studies and investigations around the world. And the program is really interactive. We got many activities besides the live lecture. You got office hours where your TAs give you support throughout the year, where you can come and ask any question that you desire about the content or the assignment or the exam or any article or the books or the readings that we provide to you. Besides that, we got optional lectures and stata sessions that are done on Fridays morning. This is optional too, just like the office hours is optional. And there are at 7 a.m. Boston time on Fridays from 7 a.m. to 8:30. And what we do there is that the senior TAs will give you, we'll present to you, give me one second, we'll present to you the practical aspect of the lecture that you saw on Tuesday night. So it's really great because besides having the whole content with Harvard faculty on Tuesday, on Friday morning, you keep discussing and seeing all the practical aspects about the same topic. So the the senior can present to you an article, I will run with you data commands, show you databases, how to interpret the outputs, how to evaluate those results, if those results are applicable to your own population and so on, what could be the limitation of that paper, how to improve that, how to prevent biases and so on. So it's a really great lecture also. And besides that is live, everything is recorded. So the Thursday lecture and Friday lectures, all of that are recorded, and the slides from the Harvard faculty and the senior TAs on Friday are shared with you. Besides all the program material that we prepare every year, because we keep innovating every year. And then the program, so as I mentioned before, we got more than 50 sites. And actually last year we got a student from 64 countries, which is really great. You will be in one group of students with people from Germany, from Japan, from Brazil, of course, Dominican Republic, from Boston, from Qatar, and so on. And many of them bring background, and they're trying to also develop research. So it's really nice for you to learn from your colleagues and know how's the policy, for example, of ethics in Brazil compared to the United States. We know, for example, that in Brazil, compensation is not allowed, patient compensation or subject compensation. Here we do, right? Because it's a way on how to promote the recruitment in the studies and so on. I mean, other things, how the European Academy works and compared to the United States and so on. So you keep learning also among the fields, because research that is done in pediatrics won't be the same for surgery, right? In surgery, we got a big limitation how to actually blind our patients. How you're going to say, I did the surgery on you, but then you don't have the scar, or how to mimic that, right? So how to blind the patient, because if not, that would introduce important bias to your trial. And then every year we're evaluated by Harvard and many other programs because we're compared. So this 9-month program is equal to 90% of the MPH in the United States. I mean, for the amount of work and content that we do, we are there. Our program doesn't offer credits and doesn't give you a master title due to the price, because here in the United States, like an hour credit could be like $250. So it will make the program really expensive, and we don't want that. We want the program to be as accessible and reachable to everyone. And we're really proud that it has been the same price for the past 6 years. It haven't got up. So it's because that's the mission of Professor Fregni. So the program is offered by Harvard THN School of Public Health in Harvard, and you will see once you come, because you also can come here for the July workshops, or if you want to visit Boston, you're more than welcome to also have if you're visiting Boston, you can attend the lecture in the university too. Like if you have lecture that week, you just let us know, and we add you to the security, and we give you the ID badge and everything, so you can access and join the lecture live with Professor Fregni there in the university. And you will see that our slogan is powerful ideas for a healthy world. And we believe in that. We believe in keep innovating and keep learning. And our faculty, as Zunilda said, they have a lot of experience doing research, and we know the research advanced because of this, how the studies are being produced and improving the quality on those reports. So Professor Fregni, as I mentioned before, he's the founder and program director of Ppcr. It started in 2008. His first site was in Brazil because he's originally from Brazil, and he put it in the USP, that is University of Sao Paulo. That's where he trained the early stage of his career. But then little by little, the program keep growing, and Professor Fregni, besides all his great legacy in research that he keeps doing, because he's also, besides being a professor in epidemiology, a professor on neurology, also in Harvard Medical School, and epidemiology in Harvard THN School of Public Health. He's also the director of the biggest lab of neuromodulation in Harvard, in the Spalding Hospital. He has other thing that is education. He focuses a lot in education. He likes to promote education and to make sure that the program delivers really great outcomes, and that we make an impact, a true impact in our participants' life. And that's how me and Zunilda and any other colleague who have taken Ppcr, they know how hard we work to deliver this quality, and they see this big network that keep in touch and keep working together throughout the years. And then, yes, we got more than 50 sites, as I said, all in Latin America, Canada, United States, Mexico, Guatemala, Ecuador, Peru, Chile, Brazil, Argentina, Uruguay, Dominican Republic, of course, now with 3. Germany, we have 2 in Munich and Dresden and Chemnitz, 3 actually, in Switzerland, in Basel, in Spain with Merck Pharma, because we also train, sometimes the pharmaceutical companies call us to train their personnel. And then in Saudi Arabia, Qatar, Japan, of course, also a great site. And Qatar, who is also one of our main sites in the program. So why do we need to learn clinical research? Why does health professionals have to learn about this? And you might have seen how COVID affected and started all the publications right away as soon as everything is starting to happen. The whole scientific world tried to made a big effort to try to understand this new disease prevention. Yes, sorry, and then
okay.
I'm sorry. So yes, so then how to promote how to understand this new disease, how to understand how to prevent it, the best therapeutic interventions, how to stop the severity, right? And find associations and the risk factors and all that. So everybody started publishing and doing. And everybody started working together, doing multi-center trials, so we can recruit people more faster to reach the sample size that could give us a power to understand the association of something. And you will learn that in the program. So little by little, evidence-based medicine is the one who help us to give our patients a better outcome, right? It could be just a better intervention, a better prognosis, a better prevention. That is the best actually a way to do it, to prevent that everything happens, right? No look for just solutions, but also to prevent that the things could happen. So where to start? Because we know that in our medical careers, we hardly see, for example, in Latin America, we hardly see biostatistics as on research that is not that deep in all the methodology about how to do actually clinical research, how to design a project and a protocol, how to ask for a grant, from where to start with your idea, how to develop that idea and be able to came with a great research project, and you will be able to do it here. So why Ppcr is unique and something that we always get asked, because there are many online programs, right? You have seen that after COVID, also many universities started many online trainings and educational programs, but Ppcrs, besides being like this will be our 15th year, okay, in the program running for 15 years. So it has shown that it actually worked, that we got the best innovative tools for you. We got the best learning activities for you. The collaboration is really impressive. We stimulate that in collaboration. We encourage you to do it. And we also encourage you to go from out of your comfort zone and start developing something. And you will see that in here. We're going to challenge you on how to create things. And not just that, we're going to guide you on how to do it. And we're going to discuss all together, your TAs, the faculty, the people in your own site, and like everyone. Is something that is really well developed. As I said, Professor Fregni also has a master in education, so he learned even more on how to promote and develop this great program. And then also, besides having all the activities that promote engaging collaboration, your critical thinking, that is really important, because for us it will be really easy that you read the paper or you read the book, but we want you to that you critically analyze why that could be correct or no, and how to prevent it, how to address limitations, how to detect bias, how to prevent that, and how to evaluate, for example, an outcome, is that correct, or is the research question properly done, and so on. And besides that, the other thing that we got in Ppcr is the teaching assistants. Last year we got 297 people that were before teaching assistants, and they keep being with us throughout the years, and they always guide and support the students every week. Every week you're going to receive feedback about your photo work, your assignment, and they're going to also help in the group project that I will explain later on. But you have a big support. So you have the office hours that are optional on Wednesday and Saturday, and then the lecture right on Thursday that is required. That's the only thing that is required. But then you also got the optional lecture on Friday morning, and then office hours on Saturday, plus the group project that I will explain and the July workshops I will explain. So we got a great design. And if you do just the required activities, believe me when I say that you will learn really well, you will learn a lot. But if you go that extra mile and start participating in the office hours that are not required, that are optional, or you watch the recording on Friday lecture and then you try to do the calculations on your own, you will learn much more. And your learning is your main goal. So how do Ppcr works for a full week? So in total, we got 24 lectures plus the tutorial. So in total, there are 25. The lectures, as I said before, they are required. You can have 7 absence, no more than 7, because Harvard takes you're going to get a certificate from Harvard saying that you studied here. And they take into account like a lot. They care that you come and connect to the lectures and interact with the faculty, that you listen, that you learn from the question, that you can also participate. So attendance is really important. You can miss 7 lectures and no more, okay? Even though that you got the passing points, because we do exams and activities, grading activities. If you don't attend, if you miss 8, sadly you will fail. But most of the people can do it. Also, if you have any issue with attendance, just let us know. Like we know, for example, we got many COVID frontline workers. So you maybe have an issue in the shift, you couldn't get out, or it's late, or maybe you are sick. Let us know, because we give support to that. So we can help you on how to manage, and just reach out to us. Even though the Ppcr is online, we work and we have a great team behind us who will give you support. We don't want to give you stress in the program. We're here to help you, support you, and motivate that learning, okay? So don't get stressed if something is happening. Reach out to us about what it is, and we can help you out. Then, so every Thursday is a lecture, right? So imagine we're in lecture 1 right now, and at 7 p.m. we finish the lecture, and we're going to publish everything in our website. So the material for the next content, okay? So we're going to put the case study, because we put a case where we explain from really basic concepts, the topic of the week. We want you to learn, not in a hard way. If you take any other book of clinical research or any topic of clinical research, you will see that it could be really strong for you. But in Ppcr, everything goes from the basic, and we go little by little, and we also allow you to choose what to do. Like if you want to stay with the basics or read more and go deeper in the topic, so you can enhance your learning more if you want to. So we give you on Tuesday the case, then we post the readings, optional and required readings that you have to do during the week, and the assignment. So you have to go to a forum discussion where you're gonna be with 25 to 30 people working together and discussing the same topic of the week. So for example, we can put, okay, dear students, for this topic, we're evaluating randomization strategies. Please read the article by Núñez et al., making stuff in my mind really quickly, where they describe the strategies of randomization, when each strategy is valid, what are the advantages or disadvantages for this, how can you apply this to your own research, or which one will be in your case for, I don't know, a cardiology trial. So I'm making stuff in my mind, but we guide you to what to look for in those papers. It's not that we just gave it to you and go think about anything that you want. Instead, we give you the hints of what to look for, how to analyze it, what is important to be discussed, and everything. So you have many topics between 4 to 7, and you can choose where to post, but you have to make 5 posts every week. A post is just a comment. So you start like, hey, everyone, I just read this paper by, I don't know, Merrick et al., and then they were describing that's how block randomization can help for balancing groups. I believe this is important because if not, this can introduce bias and confounders to our study, since we can control for the characteristics of the patients. And in my field, pediatrics, I have seen that many trials have block randomization and they do it by computer. I just make stuff in my mind really quickly, but so that's what we think, that we explain something general, that you say it in your own words, because we don't want you to copy and paste a concept from the book, because we have the Ppcr book that I will show you, but we also have it in PDF. So this is the Ppcr book. This is the first one. We also are going to publish right now, that is required, a statistics book for you to also review the basic concept of stats, even though that this book have one chapter of this book is one of the lecture of the program. So each chapter is one lecture, okay? And this is in PDF and available in the internet, I believe, for free already. This one that I have here. So it's really easy. And as I said, we go from the basics and we go little by little, okay? So then, so we got the forum. The assignment is 1 to 4 questions. It might depend on the content of the week. And in the assignment, we do also really simple questions, but what we want you to think, we don't, as I said, we want you to elaborate and to try to understand the content before coming to the lecture. This happens before coming to the lecture. Why? Because the methodology is that Ppcr is focused on the student and not the faculty, right? We are trained all careers that a faculty will stand up, that Professor X will come to do the lecture, and he will explain about randomization again. But you don't know anything about it. You just know that that will be the topic of the lecture. But in Ppcr, we make you read and discuss before coming, because in that way, you will manage better the concept, so you will understand better the faculty. You will have better questions for them, right? Because you might, while reading, maybe a concept is hard for you, like allocation concealment. What does that mean, and how does that apply in randomization? So maybe you didn't understand that well, and you can say to the faculty, Professor, can you please explain what do you do in your trials? How do you do that? How do you guarantee allocation concealment in your trials? And then he will give you his experience in research, because as I said, the faculty has a lot of experience in research. And then also after the lecture, you can do a summary of the topic of the week, and then do a summary and keep discussing with your TAs. Like if in any case that a professor did a concept that you didn't understand still, you can come to the office hours and keep asking questions about this until everything is solved. If you have more questions, you can email us at any time, me, Professor Fregni. We love to hear from you and get to know you too. But yes, so that's how a week work. You got office hours Wednesday and Saturday. The live lecture is just on Thursday, that is the only required, and you got the optional lecture on Fridays. So what is the program content? So we will begin again with pretty basic things. We have 5 models. At the beginning, we go to introduction to clinical trials, selection of the question, how to select your population, the basic of study designs, like what is parallel versus crossover and factorial, when a research question aligns better with each of the design, when can you apply it? And then integrity in research, as you know, this is really important because we have to evaluate the industry and academia relationship. That is really important. You have to disclose everything before, and also authorship in pay. That's also part of the integrity. plus the ethics in clinical research. All the ethics are really also important. And then randomization process and study binding, as I mentioned before. Model 2 and Model 3, they are more focused on statistics. Again, we begin with the basics, type of variable, what is the best variable according to the type of test, and the type of test according to the type of variable. If it is continuous, categorical, how many groups do you got? Sample size calculation, of course, is really, really important, sample size calculation. If you don't have power in your study, you won't be able to detect that difference or association in your trial or your observational study. For Model 2 and Model 3, we also use Stata. That is, as I mentioned before, is the software that we use for statistics. Stata is the software that Harvard uses. We're going to give you the commands, explain to you how to use them, how to run them, how to interpret the output of like the result, the table. What does that mean? What is a p-value? What is a c-value? Can we look for confounders in a regression model and so on? So you will learn a lot. We go over, of course, ANOVA, t-test, Kurzweil-Wallis, linear regression, of course, logistic regression, I don't know, ANCOVA, multivariate analysis, with again, linear could be again included, and then many others. And Model 4 is more a special content. We do here we also have a class that's focused on safety, because as you know, in clinical trial, you have to always care and check for the safety of our patient. We cannot expose them or put them at risk, right? So you always have to check on that, how to do an interim analysis to evaluate efficacy and safety of the intervention. Should we hold the study, stop it, or keep going, and all that things. And also recruitment and study participation and adherence, also really important, even though, as I said before, you design the best trial. If you don't gather the patients or the subjects to come in, and if they don't follow that intervention, like, okay, take this pill 3 times a day by 7 days, or this meal check that probably could have a bad taste, but you have to learn how to approach to your subject and explain them the study, how to do the work, and make them trust you so they can follow and be in your trial, have that adherence in your trial. Business of clinical research is more focused about manuscript writing, multicenter trials too. And then effective communication clinical research is about manuscript writing, because we also want you to write. It's really great that you can design, that you can run the data, but how to present those results to the world. And that is done by learning how to write a paper, how to do a scientific paper, what to include in each of the sections, how to address the knowledge of gap and the background in the disease, and so on. And then Model 5 is more focused on observational studies, because in all the rest is more focused on randomized clinical trials. That are the ones that could give more reliable data, but also observational studies are really important. If they're really well designed, they can prove positive association or negative association that are reliable, and from that you can move forward randomized trials. Also, these might differ on the type of research question that you have, right? And you will learn that in the program. So that's how the 5 model works. And then this is our Ppcr faculty, some of them, not all. Of course, we got Professor Felipe Fregni, who I already mentioned. He will be in all the lectures for Ppcr. And then we got the invited speakers. They come from 1 or 2 or 3 lectures during the program. Albert Hosman, who is the director of the epidemiology department at Harvard THN, that we're really happy to have him. Professor David Whipley, a senior lecturer also in Harvard THN. He's also the director of the biostatistics department. He also leads the July workshop that I will talk about that later, which is really amazing. Donna Hassel, who is the director of the manuscript writing in Harvard Medical School and Harvard School of Public Health. Heather Baer, who is the director of the MPH in Harvard THN. She managed to the clinical effectiveness, and then also the epidemiology MPH. And it's really nice because she comes to give a lecture to us, and she always says how Ppcr students, after the program, they apply to the MPH, and they are really happy with the outcome of those students. They know that we train them really well, and she always track them and let us know how they are doing. It's really amazing, all the outcomes that we have with our students. Then we got also Howard Sessa, who is associate professor of Harvard THN School of Health of Epidemiology too. Jessica Palacio will give a sample size calculation lecture. She's really amazing too. John Oraf, again, a senior lecturer of biostatistics. And I can keep going. All these professors are really, really great with a lot of experience in clinical research. They have done work and also teaching, because in Harvard, like, the education is also really important for all of them. So it's not just that. So the admissions, To apply to Ppcr, I can give you the link soon. You have to go to ppcr.org. I'm going to show you the page later. You have to submit a letter of intent where you explain why do you want to be in the program, what is your background, what do you believe clinical research is important for you, and how can this help you in your future career. So that's the letter of intent. And then, or personal statement is the same. Then we also need a letter of recommendation, just one, from a colleague, a mentor, or a professor who can state about your qualities and say why do they recommend you to this program. Also your CV, your curriculum vitae, all these 3 documents please in English, plus a photo that I'm missing to add here. The deadline right now is January 31st to apply. If you need more time, I will ask you, I'll add soon my email in the chat so you can, if something happens, we can go cases, a review case by case. So let us know if you need more time after January 31st, okay? And the program is targeted for both ranges, like people who just starting in clinical research, people who wants to learn more about how to analyze a paper, how to do research in their own institution, people who are doing a master right now or a PhD. So we got many backgrounds, levels, and if, for example, if you are just in your medical career right now, starting, even though that you haven't known a lot, you will learn a lot. And in the program, we guide you and give you, as I said, we start with the basics. It's not like we're going to push you, and you choose again how deep you want to go. And then for a master or PhD student, they always say, why am I going to train if I already have a PhD? But actually, even for me, or Professor Fregni, or anyone in the program, or the TAs who have been with us for more than 15 years, each lecture every year is different. Like they keep presenting and innovating every year, showing what they have done this year. Like, for example, Professor Heidelberg was presenting her observational studies from last year in COVID and pregnancy in Harvard and many other things. So it's like they keep innovating and presenting something new. So we keep learning every day. And the methodology is something different, completely different from other programs that it will enhance whatever you know right now and your skills that you have already. Even if it's low or high, you will keep learning. So it's something really nice. And then the program dates and tuition, the first lecture is March 24. It is coming. That's the tutorial lecture. And then we end by the end of November. The tuition for sites in collaboration with Harvard is that you have to pay $3,000. As I said before, the program has the same price for the past 6 years. Compared to other programs in Harvard that from 1 or 2 days, it could be 3,000, 5,000 just for a week. But Ppcr is a 9-month program with that price. And we know that it could be hard for many because of the economics in our Latin American countries, but every penny that you pay for this program, it will be totally worth it. Okay, and also there are many other possibilities on how Zunilda is always guiding people on how to apply for scholarships in your own country. She's been working with this for so many years too, so she can help you if you got once accepted in the program with the letter of acceptance, you can look for people who can support you in your own work and help you out with that. And then the 5 days immersion course is the final activity of the program that is also included in the tuition. You don't have to pay more. Before, back in my time, when I was Harvard Medical School, we paid the program that it was $7,000. Actually, I paid $7,000 as a site and $2,000 to go to the 5 days immersion course that was in Brazil. This year, it will be again in Brazil, in Bahia. And the immersion course, what it is. So during the program, between Module 2 and Module 3, we have a break. We call it the July break. So the last lecture of Module 2, statistics, is on June 30. And from June 30 to August 18, you won't have lectures. You will have group project meetings, just 1 hour meeting. And in that lecture, what you do, in that meeting, what you do is that you will discuss with your teaching assistants about a randomized clinical trial protocol that you will have to develop with your group. And teaching assistants support you throughout the way. So you're going to have 6 meetings and 1 hour to discuss to develop this project from scratch, following the spirit and concept guidelines that some of you might know. And Irene explains what items to include in each of the sections of the project: the introduction, the methodology, outcomes, randomization, blinding, sample size calculation, a statistical plan, of course, budget, ethics, data management. That's also really important, how to manage your data, and many other important points. We give you all these. We give you like a template for you to follow. We give you instructions. We also talk about this during the program. The TAs are trained on how to guide you on this. And you work together, as I said, with your group and your TAs. Now you're going to ask me what topic. So way before, students each student could propose one research question. Like if I come, oh, I want to develop, to study this drug for asthma in severe cases between children between 8 to 10 years old, school children. But then we find out that it actually was a little hard because we got many specialties, right? So what about if an oncology come with an idea of a gene therapy that is really, really detailed, and the cardiology or the pediatrician doesn't know anything about it? So they won't know how to handle that. It will be really hard for them to follow, right? So now what we do is that we give each group one challenge. So it's like develop a non-pharmaceutical therapy for a pulmonary condition. As you see, the challenge is really broad. So you can discuss together and see what could you develop. What pulmonary disease could be significant? And then you have to think, okay, am I going to adults or children? And then what intervention that is not pharmaceutical could promote, can be innovative and help in that condition? So each of the students and you have to come out with idea and go and read, where is the gap of knowledge? What is pending? What could be innovative? Because if like, why are you going to do a trial when it's not significant to do? Like there's no clinical relevance to do it, right? Or if it is already discovered and proved, like that also you won't spend money or put people at risk if it's already proven. And also to make an important change in the clinical aspect. So you have to think about that and look for ideas. So each student proposes an idea, and little by little you are defining, reviewing until you come to the last idea by voting. All of you vote and work together. And after that, you do the group project development, section by section, guided by the TA. So during the 5 days, the last submission of the group project, the final draft is on September. Last year was the 17th, so probably this will be, sorry, the 23rd. It will be the 16th or something like that. But don't worry that you will see all that in the welcome package once you are accepted in the program. But then that final draft will be sent to all the Harvard faculty. We got 8 Harvard faculty who travel to Brazil, and they will review your project there live with you, sitting in a table, and one will be discussing with you the study design. Why do you choose a parallel and not a crossover? Maybe if you're developing a cream, and in a disease that is chronic, it could work, right? Because then the patient will be their own controls and so on. So they will discuss why do you choose that strategy, and they will help you improve it. And then the statistician, they will review sample size calculation. The other one will review your statistical plan, what ANOVA and t-test, and then or the one who will review randomization. What do you do block if it could be a simple randomization because you've got more than 300 patients and it could balance the group at the end of the trial and so on. So you keep discussing and doing with them. You're going to polish that draft of your manuscript, of your protocol, in order for you to publish, because we want you to push you to publish that protocol. And talking about publication, also in Ppcr, Professor Fregni in 2015 developed the Ppcr journal, that is a journal that he created so that Ppcr students can publish without a fee. Because you know that many of the high impact journals, they charge between 1,000 to 3,000, it could be the range, just by publication, but in the Ppcr journal is free. So he wants everyone to publish, and so it's a peer review. Don't believe that it's easy. You also have to have a peer review process, and you submit your paper and it's published. It is as now indexed in Google Scholar, but that he's working really hard to have it also indexed in PubMed. So it's another project of him that has been growing throughout the years, more than 8 volumes, between 6 to 8 volumes per year, with a lot of interaction. Many students from Dominican Republic have published already, students, the DAs, and it's super amazing to see them. So something really nice. And then, so the program schedule is this. As I said, Module 1 and 2, they run between March and June. Then we got the July break, and then Module 3, 4, and 5 is by November. And during the 5 days, we got in the morning the review of the group project, and in the afternoon, you get a manuscript writing workshop that is managed by Professor Donald Hassel. You can bring even your papers, your own papers that you are working right now in your institution or hospitals or wherever you are, and he can review those papers and give you feedback during the 5 days. So that manuscript writing workshop during the 5 days is free. You don't have to pay anything. That's included. Manuscript writing workshop from the last time that we have it live, it was from 2 to 6 p.m. because that's where the name comes from. It's really immersion course. You work from 8 to 8 every day. Okay. because you're working every day improving your group project in the mornings, rotating with the faculty, and in the afternoon is the manuscript writing program. But then you have to review again your project, make the changes that you, and then based on the suggestions and feedback that you receive in the morning from the faculty. So you have to keep improving until you make the final presentation on Saturday in the 5 days. And on Friday night, if I have it here, let me go, wait, is the ceremony. So on Friday night during the 5 days is the ceremony. Right now, that's why everyone is like a little dressed up, wearing blazers and everything. Actually, this is another ceremony. This is another day. I took the wrong picture, but this is the 5 days. This is the last time that we were all together in Guarujá in Brazil. And Friday night is the ceremony, the graduation ceremony, where you go up the stage. You don't see it because you see people up, but they are up in the stage to receive the certificate from Professor Fregni. It's also great to finally meet your colleagues in person, right? You keep talking to Marta from Germany and you didn't know her the whole year, just in Zoom, but then you actually meet her in person and you can talk to her, and, you know, meeting your colleagues, the Harvard faculty and everyone is something really nice. So this is the 5 days, the last time that we were together in 2019, because 20 and 2021 were online due to COVID. As of now, it is live, set up live. We're hoping that because of the vaccines and all the safety, all the learning that we got actually through research, we will be able to meet, and as we know that the cases are mild. And then this one was the last time that we got together for the manuscript writing workshop in Boston. This is in July. This year it will be July 28 to 29, if I'm not mistaken, Tuesday to Friday. This is optional. You have to pay a little more. For the manuscript writing is $750 because you got a discount 2 days. And it's managed by Professor Kathy Brenner, the lady in yellow in the middle. She's a biomedical expertise writer. She teaches all the PhD students every year in Harvard, and she has a lot of experience on that. She will teach you, and she knows that we are not native speakers of English, so she will guide you throughout on how to do that, how to improve, how to make the wording, the connections, how to explain really well your scientific point, the proposal, and so on. It's something really nice. And this was the last lecture, that actually lecture 22 this year in 2021, because we could open the site in Boston site on October. So this was actually the lecture of observational studies and how to control for confounders. And we're here with Professor Fregni here in the middle, and all the students and some TAs of the program. So let me know if you have any questions. I'll be really happy. This is our platform. You can find us in social media too. And yes, that's all for me. And I look forward to meet you, and I hope that you apply. Don't be afraid. That's also really important. Many people come to me and say, oh, Alma, it's Harvard, it's really hard, it's really demanding. It's true. Actually, even when I applied to this program a long time ago, I was, oh my God, all the people who go to Harvard, it's like they have PhD or they're doctors, psychologists, and biologists, and then they are like 40 years old, and you are just starting in your career. But here in Harvard, it's not like I mean, Ppcr is not like that. And Harvard actually, it shouldn't be like that. We promote education, we promote collaboration. We are a really inclusive program. As I said, we got students from all over the world. What we're looking here is people that have passion for learning, and then we guide you in the program to reach those learning outcomes, and then help you thrive, because besides, after graduation, besides becoming a teaching assistant in the program, right now, as I said, we're writing the second book. This book was written by teaching assistants in the program, of course, reviewed by Professor Fregni, but all of us, like, were TAs back in that time. And right now, the statistical book is also written by TAs who invite teaching assistants to write, and because that's what we want. We want to promote your own growth. And besides that, the Ppcr journal for the learning and publishing on how to do a peer review. And you can also become a peer reviewer in the journal if you want to. You can apply to become a peer reviewer. So do peer review of an article. And then we got many students who right now, for example, last year, Professor Fregni wrote more than 80 letters of recommendation for residency programs. The MPH, today we got really happy because one of the TAs and Ppcr alumni just got accepted for the MPH in Harvard. Today, they were starting announcing who were accepted. So that was really amazing. And, you know, wake up with that email at 6 a.m. from the guy that is right now in Switzerland. You know, it's really amazing to see our students to keep thriving. Like, we got many great studies from Ppcr alumni from Dominican Republic too. I always talk about John Polanco. I don't know if he's connected right now, but he took the program in 2018. He wants to be a surgeon here. And then when I met him in Boston, I was, oh my God, but surgery is really high, like the competition to get into surgery in residency in US is really hard, like it's really, really high. So then we advise him to do the IRE, that is another option if you want to do, or become later a research fellow in any of the labs of the Harvard Hospital, like do have practice on research, just like Zunilda did back in 2012. And John did it, and that program is a volunteer position, meaning most of the research fellows in Boston, you have to pay to be there, like $9,000 a year. But then in this case, in IRE, the people doesn't pay. It might depend on the hospital, but they don't pay. Instead, when John entered, 1 month later, they offer him a paid position. So they started paying him. And after that, he did the MPH in Harvard. And now he's in his first years of surgery. Beth Israel Decones, one of the best hospitals in Harvard, for doing his surgery residency. So it's our big pride, and we're really happy. And just like him, we have many other success studies, like right now, another Ppcr alumni is applying to be a faculty in Harvard too. Having a faculty title in Harvard is also really hard to do. But all of her experience is really amazing. She's doing that right now. And many other people around the world, like right now, also I know Stephanie Enriquez got approved for the Fulbright. She will do the MPH in Harvard too. Like, you know, that she's also from the Dominican Republic. Juan Santana from the Dominican Republic last year. He's currently an MPH student too. I got, I believe 4 students are right now in New York doing the residency in internal medicine from the Dominican Republic. You know, so there are many other great things. And besides that, they're being Ppcr teaching assistants, you know. So it's something really nice. And we coach you throughout the year. We also have Ppcr talks, a Ppcr journal that I didn't mention. All that is optional. You don't have to enter if you can, because we know that also you have a busy life, right? You have your work, your family, your friends. But in Ppcr, that's the beauty, that you got 1 week to complete the activities. So it's not like I told you, okay, I don't know, Wanda, I'm sorry that I said your name first. You have to do the assignment today. No, I give you 1 week. So you can do it at 2 a.m. in the morning in the hospital where you're doing the chief, or on Sunday at 6 before your kids wake up, or on Sunday really late after your kids are in bed, or I don't know, or you can do posts in the middle while you're going to work in your phone, because River, the platform that we use, is also, you have an app in the phone, and you can read your colleagues' posts after you post, because you make the post and then people will come and reply and say, hey, Wanda, I really like that point. They explain how to do, what are the ethics concerns in the pediatric field. I also believe this, and that. So someone will reply, and you will be eager to look for what your colleagues' response to you. And that's great, because you keep learning, you know, from each other. So yes, you have 1 week to do the activities, and if something happens, just let us know. But yeah, we have deadlines, 1 week of work, the 5 posts and the assignment, and we got one exam per module. Besides that, like to pass the program, you need 725 points, but you can reach up to 1,000 points, okay? But after that, we created, by Professor Fregni, 160 points in extra activities, so you can actually reach 1,160 points if you want to. But we give more opportunity for you to gain points when you miss it, because you were on the chief, or because you were on vacations and the computer didn't work and the internet was bad. So you get many options to get more extra points, and we put bonus activities for you to do. Bonus, and they're optional, up to you to do it. But and we also give you the option to do it in a creative way. So we say, oh, you can develop a video, a PowerPoint, a Jamboard that is like a Canva where you can make like drawings and diagrams, or what about if you do a creative way on how to talk about any topic of clinical research. So for example, last year we got one student who were talking about clinical research, singing the guitar, playing the Old MacDonald song from the United States. I don't know if you know it. By just adding the names. Other people were doing videos of Halloween about how they were afraid of the statistics and so on, and then how that changed. So yeah, and we also ask you, like, you can review a paper, and you can say, okay, so choose a paper in your field and analyze it and present it. So you choose whatever paper you want, and then you evaluate their design and say, I believe the design is limited because they use convenience sampling, so this affect the generability of the results and so on. And so you explain, you see, so you evaluate the article and then you explain. And yeah, so as I said, we got many activities. I don't want you to worry. If you do the required activities, you will pass the program. And I know that it's a really nice certificate. Actually, I have one here because of the last time that I got mine of the TAs, but this is the folder where you get it. And this is my TA certificate, because I'm also a TA, even though that I work here, I love to be a TA. But what we learned what we care more is that you learn a lot and that you can keep growing after Ppcr and do something about the Ppcr. So yeah, so that's from me. So yes, I will stop talking now and hear you guys. And if you have questions, you are more than welcome to open your mic or type in the chat. If you want to speak in Spanish, it's also okay. And I'm here to, and Professor Fregni is connecting soon, but I'm here if anything.
Yeah, Dr. Sanchez, thank you so much. We have one question at the chat, and it's, are the books mentioned freely available for interested applicants or only for people that have been admitted to the course?
Melissa, great question. Actually, this book is in Amazon. If you type right now Felipe Fregni, that is our program director, you will find it. In Amazon, this is the first edition because it's the only one that is printed, but in Amazon we have it online, the version online, and the version online has the corrections because there were a little typos on the book. This one doesn't have it, but when we start the program, we send the typo list. But we got this book, and right now we're going to publish the statistical book, the other one. So this one also covers statistics from all the lectures that I mentioned in the model that you saw are covered here. But the new book will be just focused on statistics. 11 chapters, actually 13 if I'm not mistaken now, because we separate some. So they it's really focused on statistics, the other book, and it will be published on Amazon probably in the next 2 weeks. We're still working on it, but it will be amazing because it's also done by the DAs. Okay, but great questions.
Perfect. Do we have any other participant who will wish to? You can raise your hands. Anyone who has another question? It was all very clear, Dr. Sanchez. So it was very, very detailed information. So thank you very much. I have a raised hand from Victor Polanco. Go ahead.
Thank you. Good evening. I would like to know if does the university have some scholarship, grant, or financial aid available for this course?
If it's for me or for the sites, right now, if it is for Harvard, as of now, we don't have scholarships available because, like I said, we try to minimize and maintain the same low price throughout the years. If you apply, just let me know. Like, it's really, really hard to get it. But if you send an email to me, I have my email also here. I'm sorry that I missed it. But also I know that Zunilda, as I mentioned before, they always help and guide you on where to ask for help in Dominican Republic. Yes, go ahead.
In terms of Two Oceans, as a site, we might have some limited scholarships available further on. The procedure is basically that you apply to Harvard, you get accepted, and once you have your acceptance note, then you can apply for a limited scholarship with us. As you know, we are a small enterprise, we are a small institution, so we cannot promise or guarantee scholarships to anyone, but we are definitely going to support a limited number of participants with partial scholarship, depending on your academic merit and on your academic profile. So we cannot promise anything, or we might try to make arrangements on the site to at least reduce the amount of tuition that is needed to initiate the course. Then later on, depending on your performance in the course, which is something that we appreciate very much, Harvard is very strict about the performance, assistance, attendance. And so based on the performance, some of the particularly successful participants could have additional support for the travel to Brazil, et cetera, et cetera. But for the start, once you get accepted at Harvard and you apply for a scholarship at Two Oceans, we might be able to make some limited arrangements. I don't know if that answers.
Thanks. Great.
Also, I saw a question about the exam. So the exam, before there were multiple choice. Right now, just one is multiple choice, exam 5. But now what we do is that we provide a published article that could be in Lancet or New England or any other high impact journal. And each student receives an article, and then we ask between 5 to 6 questions, it depends, about the article. So for example, I can say like, is the research question really well stated? does the research question align with the study design? Do you agree with the randomization strategy? Yes or no, and why? Do you believe that these study results are valid? Yes or no, and why? And so on. Oh, so Laura is here. Laura, if you want, you can open your mic and talk. Also a great student from us like last year. She received an Escuela award. I mentioned to say that. So the Escuela award is the prize to the best students in the program. And every year, Dominican Republic is also, they have a great representation with this. So Laura is here. I don't know if you would like to talk or you're available.
Hello, everyone.
Yes, okay.
So yes, Montez, I was a student last year. It is a great program, especially to people that want to learn more about statistics and clinical research. So if you have any question, you can reach me too. I think Wanda has my contact. So any question are available too. And like I was answering the question to Melissa. Melissa, you don't have to worry about like the things you have to do in the program. You only need to schedule. And you even also have like a teacher assistant that can guide you in the process. So you have a detailed program and you have only to follow and be open to learn about it and taking the class and learn. And it is an awesome program. And hi, Dr. Zunilda. Nice to meet you too.
Well, great, thank you, Laura. Yes, so let me see if we have another question.
Yeah, I also want to say that during the program, you will see that exams and assignments and doesn't have the high impact in your grading. The highest grades come from the forum every week, like the discussion, right? So that was 33% of your final grade, and the group project, that is 21% of your final grade. So if you work on that and you're constant throughout the week, you will make the grade. Okay, so don't think that you will fail. Like, and if something happened that you cannot complete activities that week, reach out to us. We will find a way on how to give you support following the program policy. And as I said, we don't want you to give you stress. We got like a great team, like I said, 300 TAs. And then behind me, I also have my colleagues who are not connected right now, but Megan and Alan. And then the admin group that you will meet too, the other Megan, Natalie, Henrique, and Professor Fregni, who we believe it or not, we read everything every week. We follow how the students are learning, what are the doubts every week, so we can discuss it again during the lecture. We emphasize on those errors during the lecture. The post, in Ppcr, you will see that there is no right or wrong, because each design or each strategy could be applied to different methods. Like, I don't know, like if the research question is different, the phase study will be different, and hence the population will be different too. So, and you will learn that in the program, and a post won't be invalid because you'd say a concept wrong. A concept wrong won't make you lose your points, but we want you to try to learn and explain your own words what we're doing. And if something happened, the TA will tell you like, hey, I saw they were talking about sampling bias, but please remember, and they will call your attention privately, right? Because TAs and faculty, we don't go in the forum, but we just read that you are working and discussing with your colleagues, and you learn each other. And probably another student will call, a colleague will say, hey, Wanda, I just read your post, but I believe that probably this could apply more to this type of design. And, you know, they will give ideas. Or what about if we do this? Like if you propose a simple blinding for your group project, probably, give me 1 second. I'm sorry. So let me put
Hello, everyone. Hello.
Hi, Professor. Yeah, okay.
Hi, Zunilda, Marija, how are you?
Hello. How are you? It's great to have you here.
Wonderful. Sorry, I was in an NIH advisory panel meeting. I just got out now. My apologies for not coming before, but I just wanted to say a quick hello. And let me just say a quick hello to the group here, just again, and wrap up as we So as you know, I'm a professor here, a full professor at Harvard Medical School and Harvard School of Public Health. I have a laboratory, a research laboratory. I'm a neurologist. I was trained in Brazil, did my residency, came to Boston. So one thing that, and I do identify myself with a lot of you in countries in Latin America, because that was basically sort of my background. So again, I did my medical school, University of São Paulo, Brazil, my residency there. And when I finished the residency, I had a great clinical training, but very little research training. I did some research exposure during medical school. When I finished residency, I entered in a PhD program, but the PhD program that I did in Brazil was very focused on the science of the project, not on the methodology. So it was interesting. So it's a lot of PhD projects there, they call statisticians to help with the data analysis, etc. And I did not learn very little on methodology. And then I came to Harvard and I realized, look, I need to learn that. And that's when I did my first master's degree in the medical school. And I said, why not? Can we deliver that to my colleagues in Latin America and other countries as well, other places, but I was initially thinking in Latin America. So can we deliver the same training I got here at Harvard to my colleagues there, so they don't need to travel here? And of course, if they do need to travel here, that's wonderful, but it's more expensive, more planning, more everything. So that was the idea, how this program was modeled, and it was interesting. So the program grew exponentially. And especially because we have one mission here that I think if it's not the only one, it's one of the only programs that do that. You know, I'm very focused on we are focused on, can we help you to go to the next step? Meaning, you know, I don't want you doing Ppcr just to learn statistics and epidemiology, which is very important even for a clinician, even for those who say, look, I don't want to be a scientist, but even for those, learning methodology is very important, so you can read a scientific paper without skipping the statistical analysis and understanding that, and understanding why that's important, understanding the data, understanding what's an effect size, understanding what's a p-value, and so on. But I don't want you to come just because of that. I really wanted for you to come and have an impact on your career. That's why we are so focused on helping you. So some of you wanted to apply for a master's, some of you wanted to do more things. We also, we like to invite you to become a teaching assistant. We have so many teaching assistants that have been with us for many, many years, meaning they have been training the program for many, many years. So they continue learning after the program. So, and that's our goal. So then you can truly become a great scientist or a great clinician with a great knowledge. So you may be enrolling for a 1-year program, but maybe with us for 6, 5, some people are with us for 10 years. And that's our goal. And that's one thing that I met Zunilda 10 years plus more ago. And when she came to Boston for visiting a scholarship here at Harvard with my colleague Vera Novak, but it was more than that, yes. So then she spent here, and then she was very passionate. I think her story and my story are very similar as well. So in a way, you know, I came from Brazil, thinking initially in Brazil, and then expanded for Latin America, and that was her goal as well. Can we expand that to our colleagues in Dominican Republic? And that's how we are seeing this expanding so fast to our colleagues. And you know, so these things are long term. I don't think we'll see the results in 1 year, 2 years, but I'm sure in 5, 10 years, which is coming soon, you see the impact of this training for our colleagues in Dominican Republic. So as you go along, as you teach your medical students, as you improve methodology, learning of methodology. Anyway, so that's what I wanted to talk to you. I know the program is even though we try to keep as low as possible for Harvard standards. So for Harvard standards, this is a low cost, but I know for Latin America, and even for other places, it's expensive. Being part of this program, it's a long program. It's a 1-year program, but I want you to, again, really consider so that, and think as well. So what is the impact you wanted to have in your career? So, and that's what we are looking for. We really wanted for you to come, learn, use that in a profession, either as a researcher or a clinician, and help to spread this to your colleagues in Dominican Republic. So with that said, everyone, we hope you can be part. My goal is to expand this program as far as with as many people as possible, so we can continue disseminating that. That is my main goal with this program, and build this community. We can be learning together, and we can decrease this gap as well. So there's no reason that we can't have more big papers that will have an impact from Dominican Republic, from Brazil, from Mexico, from other places as well. So especially now that communication is so much improved and so on. And I know one thing I was discussing with Alma, I know everyone is a little bit tired of Zoom and online meetings. We are too. But the good thing is that we hope that we'll see as well. Of course, it depends on Dominican Republic health regulations, but we hope that we are seeing a light in the end, at the end of the tunnel, meaning that hopefully we'll start going more into. So this program was designed, if it's okay in Dominican Republic, that you guys go using the protocols, going to the site. If not, we have the options to be interactive. But if it is, so that's one thing as well. So then you start interacting more with your colleagues and live. And we also hope that we can meet in the 5-day workshop that we have. We are also pushing that to be live as well. Again, we hope that will be live, the 5-day workshop we usually hold in Brazil. We have the one in Boston, but the Boston is optional, it's not part of the program. But anytime, anyway, someone wants to visit here, it's always very welcome. All right, I think with that said, Alma, I know it's long, 1 hour and a half, you guys connected, but other questions here. And it was wonderful as well to see our colleagues from Oceans in Health. I look forward to visiting. So I promised Zunilda that when the pandemic, I had my tickets even, I had bought my tickets to Dominican Republic. I think I was flying March 5 or 10.
9.
And it was exactly
March 9, yeah.
Yeah, March 9, yeah. Was exactly when pandemic hit and we are not allowed to travel, et cetera, et cetera. And you know all the story. So, but hopefully soon then I can go and visit.
Great. So thank you so much, Professor, for your time and for joining us. And it's a great pleasure for us to have Maria Zunilda working with DR, and now Marija that's also promoting clinical research in her side. Wanda, wonderful work, amazing how you have been presenting everything today. And now I know that Wanda wants to show everyone how to apply to Ppcr in the web. And I will take more questions also right now for you.
Great, thank you very much. So we want to invite you to register for the Principles and Practices of Clinical Research course into Oceans and Health site. So I will show you how to do so with a quick video. Let's see if, okay, here it goes. So let me know if you can see it.
Yes, we can.
All right, so let me hit play. There you go. So you have to select the courses you will be participating in, and then you will simply have to select where are you planning to attend. So you on the site location, you will enter Santo Domingo, and if you can see here, we have 2 sites. So Two Oceans and Health sites is the last one. And then you just click on next page, and that would be it. We have the link also, ppcr.org. So I would put it on the chat so you can enter for the application. So thank you so much, Alma. That would be it for me. If any of you would like for me to show you the video again, you would just let me know. And let me put again the link to the application. Here you go.
Great.
So again, if you would like, I'm sorry, if you would like more information on the partial scholarships that Dr. Merrick was talking about, you can contact info@2oceansandhealth. So just remember that the deadline to apply is on January 31st. So you still have a few days to complete the application. And thank you everyone for joining us today.
Thank you.
Thank you, Ryan. Nice to see you, everybody. We will have interesting meeting in the future. You'll see, because I hope sometime in Punta Cana, we will have the five-day workshop someday.
Yes.
This is in the program. You will like it. You will like it.
Very much.
Amazing, amazing. And we are in the middle of the board, you know, and you will like it because it's really nice. It's same as Bahia. We have some, and if you go to Cap Cana, you can't imagine. This is other world in Dominican Republic.
Nice. Yeah, so
High quality.
So before the pandemic, we're thinking now for this year, it's a little bit weird as well. We thought of going a place that Harvard knows, but then for next year or the future years, I definitely wanted to explore that 100%.
Looking
You
forward.
like it. You like it.
Send me suggestions of potential hotels, and then I can start working for.
Of course, we will do that. And Alma can come at any time and see it.
Wonderful, beautiful.
Great.
So very good, everyone. So wonderful to meet our potential participants. Any questions you have please send it to us, to Alma, to myself, to our great colleagues as well, Dr. Marija, Dr. Maria Zunilda, Dr. Wanda. Yeah. So Alma, anything else?
No, just I want to say thank you to everyone to this great site, and to also the TAs who applicants who joined, Laura Santana, who also talked about her Ppcr experience, and we hope that you can join us and become part of our family. Okay.
Wonderful.
Great. Have a nice time. Take care of everyone.
Nice seeing you. Bye-bye.
Bye-bye. Thank you.